Hello, everyone. This is Dr. George Gonzalez. I'm the founder of quantum neurology and the founder of holographic number theory, as well as the author of holographic healing. And I'm so excited to introduce you today to Dr. Noah Moos. He's going to be speaking at our homecoming conference, November 11th and 12th. And his topic will be on structural integrity using vector, posture, and positioning for improved lower extremity injury outcomes. Welcome, Noah. Thank you so much for being here today.
Yeah, glad to be here.
So tell me more about how you came up with this concept for speaking, and tell me a little more about the vector, posture, and positioning concept.
Okay, yeah. So I kind of came up with this as we work with a lot of athletes in our practice, a lot of like multidimensional sports, things like that. And you'll see things from like rolled ankles and knees and things like that. This concept actually came to me when I was rehabbing a heptathlete, and she was actually supposed to have knee surgery, and nobody had been able to figure out what was going on with her or how she was, like how to recover her from this injury. And so I just started, kind of, we would do kind of the traditional work that we would do, and it would get better. But when she would run or do anything or put any pressure on it, we were finding that there was, that things just kept blowing out and she kept having pain. So what we started to do is look at putting her in different postures, position, moving the knee through different vectors, and actually correcting in each vector throughout the whole range of motion. And we would find that as she would move it through a certain motion, everything would inhibit. So we decided that we're like, okay, let's just go through and let's work this through each vector, each position, each posture, correct that. And within 15 minutes of doing that, we went all the way through the range of motion of the knee. We corrected at each segment where it weakened. And then after that, she was able to just run up and down the street at that time. And I was actually working on her in my parents' garage of all places. So, so you know how they always say like good things are born out of garages and stuff. I guess this talk was actually born out of my parents' garage. So, and she was able to run. Went back, had a full evaluation with her orthopedic that was supposed to do the surgery. They're like, you're actually not going to need to do this surgery anymore. And she was able to go on, and she was actually a senior in high school. She went on to win 4 state championships and get a scholarship to the University of Washington. So,
Wow.
So went from basically losing her senior year in high school to 4 state championships and a Division I scholarship. So. So it ended up, so that's how we came upon this whole thing. And I've been applying this concept in our practice and tweaking it and, finding different things in the ankle and the knee and the hip that we can do with some of these things to really improve the outcome of these injuries. And they're very, very subtle things that if you just take the time to do, it can really improve the outcome of anything and any extremity, but really specifically the lower extremity.
That's exciting. That's exciting. And how long is the process that you're talking about? How long does that take to apply to the patient?
So after we do kind of the initial correction, we go through. It may add, depending on how many of the different positions are there, maybe 3 to 5 minutes. So it's actually a fairly quick process once you get really efficient at it and learn how to correct it. It becomes a really quick, efficient process that may add maybe 3 to 7 minutes at the most to your to your thing and to your treatment. So it's something that I think anybody could really apply in very easily.
Very exciting. And have you applied it to upper extremity or to the spine at all, or is it mostly?
Yeah, so we'll do it. I've used it in elbow. We have a number of tennis players and stuff. So I've actually applied it in the elbow. I haven't done it too much with the shoulder. Your shoulder release that everybody should be learning, it pretty much takes care of that. So we to apply it too much with the shoulder after we use your shoulder release, but you can see it in the wrist and you can see it. I've done it in the elbow as well too. So
very exciting. And how often do you need to apply this concept to a patient after it's done?
A lot of times, most of the time, once you go through and correct it the first time, it really seems to do a good job. You may, in every case is a little different. You may have to do a little follow-up, 1 or 2. treatments with it, but very rarely do I ever find myself doing this procedure a number of times. I usually find that maybe 2 or 3 times at the most, really, that I find that we have to do this. Once you kind of restore everything, it's kind of like, once that nervous system has been restored, then through that whole range of motion, it really seems to hold, so you're not really having to do that much else in that area. And
what tools are you using to achieve this?
So I'll use my 2 thumbs
yeah.
and the arthur-stem a little bit, and I do I played between the arthur-stem and the activator, depending on some patients, when you're using it to correct some of these things, other people do better with the arthur-stem. So those are really, but most of the time, when I developed it, it was these 2 guys right here. So yeah. So everybody's got those, hopefully, and if not, we've got other ones we can use.
That's right. So did you use a GRT light at all to lock in the
Oh yeah. So yeah, the GRT light obviously enhancing that. Once you when I first developed it was before I had done any of the quantum neurology training, but now as we go through, after I correct this, I actually like to use the GRT over the area and actually do some erasing and stuff like that too, once we've kind of cleaned up that pattern in there, to kind of resync everything, so the GRT light and erase becomes that extra layer that ever since I've figured out how to I've learned to erase. It's like just you do this, you erase it, and boom, they're like out there kicking butt.
Yeah, erase is a big deal. It's a big deal technique, and we've noticed that especially after doing any sort of stretching or muscle lengthening, to do erase afterwards is extremely powerful, because you have this new gain of function or functional range of motion that has not been trained yet. So erase will train that new range of motion in the areas where it doesn't have strength yet, and how to coordinate that movement through range of motion. It's very powerful. So what other things, what type of athletes have been using this on, or regular patients, or what kind of patient population have been doing this to?
I've used this on a number, just not your general athletes and stuff. There's a few things that I see a lot. The athletes that, or the patients that have I think this is when I demonstrate this, one of the big key indications is that person that has that kind of upper hamstring glute, so that just is very unresolving. I've actually used it in patients as they age that are having trouble getting up and down out of a chair or walking upstairs. I've got a number of patients that we've been rehabilitating lately that they just have trouble, like their issue comes walking up and down the stairs. It's not so much the strength, but they get tension and pain in the upper glute, hamstring, and all of that. And we correct this issue, and this knee has some way is connected in there. It's causing the hamstring to almost be hypertonic, and so as we kind of correct that, it actually allows the hamstring to kind of refunction normally. So you'll see it in a lot of people with this upper glute GI issue, up and down stairs, mobility issues, people who are having strength issues through range of motion. It really seems to be very, very good at correcting a lot of those things.
Very cool. And when I know you work with a lot of different athletes and different kinds of things, you do a lot of concussion work as well. What kind of concepts will complement this kind of therapy? What other things are you finding that complement what you're doing with these patients?
Yeah, so really, our kind of big thing is once we get somebody in, and usually, in our office, it's going to be because of some type of an injury that's limiting them from doing something. That's kind of the traditional way that we see them. And then what we always encourage is, if you come in to see me, I'm pretty much considering you a life patient. I want to I want to take you and allow you to reach your highest levels. So what we do considerably with our athletes is we get them on an every 3-week schedule. The fall time is always crazy for us because, as you just talked about, concussions and rehabilitation, we have a ton of football players that we work with. And, we're from Texas, so we've got the whole Friday Night Lights thing going on down there. But what we've seen is as these athletes, so we basically, if we have a football player, we suggest they just schedule once a week for the entire football season. And most of them are pretty cool with that. We have 2 programs that we work with. They both played for the state championship last year. One of these programs, before I learned quantum neurology and we were working with them extensively, I think they had 9 or 10 concussions in 1 year. Over the past 2 years, since I've learned quantum neurology and been just doing regular treatments with these athletes, it's usually 1 or 2 a year, and it's usually from a very traumatic event. Whereas some of these kids, it was towards the end of the season, it's like, they just get tackled, and it was, something that probably shouldn't trigger a concussion, but the repetitive injuries that they'd had without the neurological restoration, continually, it would be something that you wouldn't traditionally think would cause a concussion, but it was just because of the repetitive impacts and stuff. So we're like, hey, get treatment weekly. It's like either before the game, so we'll see a lot like Thursday afternoon is pretty much our entire day is like, football players just getting tuned up for Friday night. And we've seen dramatic, resistance to injuries, and especially like concussions. I mean, we treat some of the coaches, and the coaches are like, man, we're just we're amazed by how well these kids come back, how the injuries are reducing and things like that. And we also have a joke too, that these 2 schools that compete against each other, there's a huge rivalry. And I tell the coaches, because we treat coaches from both teams, I say, we've actually kept stats on this. I did it this year. I kind of went back because it was kind of funny because we were starting to get more kids from one of the other schools now. And so I went back and looked, and I kind of looked at our patient files, and we calculated out how many kids from each team saw us. And the team that sees us with the most, has the most athletes seeing us, usually wins that rivalry game. So we told the coaches, we're like, the defining factor is how many of your kids are going to see me. So let's get them in there and get them rehabilitated so they can perform at their best. So we joke with them a lot about that. But really, in all honesty, I mean, football is a very intense, it's a very intense, it's a violent sport. These kids, they need the rehabilitation, they need the work. So it's, and we don't clear them or anything like that for play. That's all on the medical staff if they have an issue and all of that. We work very closely with the team docs and all of that. I let them fully evaluate that, and the docs just comment. They're like, man, these kids are doing a lot better. So it really, the repetitive, or not the repetitive, but just the repeat treatments and the continual work it's just amazing what it does for these kids. It just allows them to be healthier, and that's what we want. We want them to be able to enjoy the sport, and we want them to be healthy doing it. And we don't want, all the things that you're hearing now in the media about the CTE and all of that. We want to do whatever we can to prevent that for those kids, because we all know sports is a great builder, but we also don't want injuries down the road. So we try to do our best with what we have to help those kids. And I think quantum neurology is a huge thing for kids to function at a higher level, to resist injury, to prevent that neurological damage that just is gonna happen with the sport. So
absolutely, well said. And you have a lot of experience with all these type of athletes, especially in the track and field area, because you yourself were a track and field athlete, and your wife still is an athlete as well. So hence the lower extremity techniques and working with all these running teams and sports is powerful. Now, for people who don't know where you are and how to get to you, why don't you tell us how to get a hold of you and where you live and how to make an appointment with you? Hello?
What's that? Sorry.
I said, how do people get a hold of you if they want to come in and be a patient? Did I lose you there, Noah?
Yep.
No?
Okay, I'm here. I can hear you now.
Okay. I asked, how do people get a hold of you to become a patient of yours?
Really, we Quest or we healthplusaustin.com is our email, or they can contact the office at 512-524-5292. But yeah, healthplusaustin.com. They can fill out the little request for information, and we'll get a hold of you and be glad to help out whoever needs it. So
Excellent. And you're in Austin, Texas.
yep.
And you're going to be speaking at our Quantum Neurology Homecoming event on November 11th and 12th, 2016. And we're really excited to have you there. And, excited to share about all the different doctors that are coming to this event to share their experiences with using quantum neurology in their professional fields and the success that they've had. They're sharing it with our community. This is the first time that Quantum Neurology Homecoming event is open to the public. We're allowing any doctor of any profession to come and observe and watch, as well as experience quantum neurology firsthand. The event is also open to the spouse of the doctor, as well as the staff of the doctor as well. So we love to see everybody, and Noah, I look forward to seeing you there.
Absolutely. And come get your mind blown.
That's right, definitely. And what's been your experience at coming to previous events?
Oh man, they're fantastic. The level of knowledge that is as disseminated in this group is just amazing. Like the quality of people that are in this. I've never been around such great, intelligent people. So I'm telling you, if you're a doc and you just want to kind of see what it's all about, just come. Like you will not be disappointed. I mean, I'm actually pretty humbled because I'm like to be able to speak and present with some of these guys, because some of the stuff that these guys are doing is just, it's phenomenal. Like I feel very humbled and very blessed to be able to share my little bit on structural things, but some of the things that these guys are doing, you'll learn how to change like patients' lives like in like no time. So you got to be there. That's all there is to it. It's like you've got to be there.
I completely agree, and you're so right. And it's hard to convey the level of ability that the doctors that are using this technique have, and the ability of access to the nervous system in the different areas of the body that are able to be affected through neurological rehabilitation. It's pretty staggering. And even for myself, when I developed this work, it was for my wife. I didn't know the wealth of application that would be coming from this concept. So it's so powerful, even for me to watch and in amazement of, wow, look at what so-and-so is doing with these concepts. And doctors like Noah and Dr. Vlasic and Dr. Pascal and all the wonderful doctors that'll be presenting at this event. So we really look forward to having you there, Noah, and look forward to seeing all the other doctors and seeing all those people that are watching this broadcast as well. We look forward to seeing everybody there. Thank you so much, Noah. We'll be checking in with you soon.
All right. Sounds good. Y'all have a good one.
All right. You too. Bye now.